This conference will now be recorded.
Good morning. Today is Friday, October something, the 12th. Where did the month go? This morning I'm doing this for a friend, how to discuss, illustrate, and apply for Hospital Indemnity. And if you've been watching a series of these videos, I always put up a disclaimer. I'm going to not read it. I'm going to count to 10 in my head so that you can read it yourself. And since this is being recorded, you can just rewind if you missed anything. So 10 seconds starts now. Okay, so a lot of things that come up in conversation about Medicare Advantage plans is there's a lot of holes in a Medicare Advantage plan. And what are some of the common holes that make agents uncomfortable that present them and make prospects uncomfortable when they're considering them? And I would say the number one topic that comes up a lot is what would it cost if they were confined to a hospital as an inpatient? And typically, for most plans, again, this is just a guideline. It's not the rule per specific plan. But typically, the daily copay will range from somewhere of about $100 a day to upwards about $450 a day for an in-network hospitalization. For the most part, you'll see most of the daily copays will be in the $250 to $300 range, usually 4, 5, 6, 7 days. For in-network, but that tends to be the range. Out-of-network, it's a much bigger bite. It's not uncommon to see $450 a day for 30 days out-of-network. Skilled nursing facility, they're not quite sick enough to go home, but they certainly don't want to keep them admitted. After a 3-day stay, they'll send them off to a skilled nursing facility or a rehab center. Medicare foots the bill for the first 20 days. If they're in a Medicare Advantage plan, there's typically some coverage from days 21 through 100, but it's usually a daily copay. And that copay could be anything. It could be $20 a day. It could be $100 a day. It's plan specific. Big one that's been coming up lately is cancer treatments. You know, sadly, everyone knows somebody that has either had cancer or experienced a family member with cancer. And cancer is not cheap. And most of these Medicare Advantage plans has a hole when somebody is diagnosed with cancer for cancer treatments. And the hole is usually the 20% exposure up to the maximum out of pocket. Ambulance rides, outpatient surgical costs, people ask about that sometimes. They're typically a fixed copay. In some plans, they're a fixed percentage. Pay very close attention to the outpatient surgical costs of any Medicare Advantage plan because, believe it or not, that benefit would be used far faster and greater than an inpatient hospitalization. So a lot of people don't realize they have this out-of-network benefit. They have to pay 20%. They go to do some simple hand surgery for carpal tunnel or cataracts or something like that, and they got to come out with $2,000 before they walk into the surgical center, all because of that 20%. If they were in a fixed copay plan for that particular risk, they may only have to come out of pocket $250. So very, very important. I would say that's one of the most overlooked part of a Medicare Advantage plan is the outpatient exposure. Durable medical equipment, you don't really think about this. The modern day 65-year-old is riding bicycles, vacationing. It's not the days of what we remember our grandma and our grandpa were like at 65. So you don't really think about durable medical equipment a lot, but when you're working the older market, 70, 80 years old, canes and walkers and wheelchairs are not uncommon, and they can be very costly to some. End-stage renal disease and dialysis. And then looks like I listed durable medical equipment twice. So I guess it's really that important. So what we're going to do right now is we're going to just jump right in, and I'm going to show you how you would illustrate and start to bring up the conversation with Medicare Advantage and Hospital Indemnity. The tool that's really good to use that you can illustrate and show a client is the CSG tool. CSG tool is a very good tool. It's a tool that we let all of our agents use at no cost. We pay for the subscription, and the person that I'm helping out with asked me to do Clark County in Georgia. Okay, very nice gentleman. new to the industry, and he's really doing well from what I understand. So I'm going to pick a plan that's just common. Okay, this happens to be a commonly recommended, very common in the lower resource or lower income market. This one tends to pop up a lot right here. So naturally, whatever plan you're recommending to the client, you would open up in CSG. Now remember, you can't give this to them because it's, quote, not CMS approved, but you can absolutely show this to them. And so you would click on plan details here, and what happens is it brings up the details of the plan, and it kind of goes through all the things. So maximum out of pocket, $6,700, ambulance, $265 copay, dental services, diabetes, renal dialysis. There's your end-stage renal disease, 20% per visit. 0 for the primary, 40 for the copay, $90 for the emergency room, home health care, hospice, inpatient hospitalization, $290 a day for 7 days. Inpatient hospitalization. Remember the 7 days. And you just kind of go down here a little bit, and it kind of gives you an overview of the tiers for the drugs. Outpatient rehabilitation, outpatient surgery, it's a fixed copay. One of the most overlooked features of a Medicare Advantage, and probably the most costly, in my opinion, of anybody on a Medicare Advantage plan, is this area right here. This is good that it's a fixed amount. Just kind of looking down, skilled nursing facility, look at that, 0 copay for 20 days, and then it pops up to $172 a day for days 21 through 100. So these are the holes in a Medicare Advantage plan. Now the trade-off, in case you're wondering, the trade-off is the cost of this plan is $0. So that's the trade-off. The trade-off is you're not paying anything monthly for it, but you have all these pay-as-you-go expenses if you have to use them. So after you've done your due diligence, you've determined that this is the right plan for the consumer, you've checked their medications, you've checked their doctors, you've done everything at this point. At the end of the day, this is the plan that makes sense for them. This is the plan they want. This is the plan they're going with. Now what you want to do is you want to transition the conversation over, and you got to, of course, make sure you have the scope of an appointment signed. I'm assuming all of this. But you want to turn the conversation over a little bit, and you want to point out the holes of the plan. I am the kind of individual that will tell you that something is good. I will also tell you what's bad about it, but more importantly, I will tell you what's ugly about it. And I usually share it on experience. So I would communicate with this individual, and I will let them know that their biggest risks fall within some of these holes. And what a lot of other people have done to minimize these risks is for just a few dollars a month, they have decided to get a plan that would pay for some or all of those holes. And I can illustrate that by just going here and clicking the box, fill in the gaps. It's going to ask me for the zip code again. Okay. And then we'll just say that this is an age 67-year-old female. Okay. Just randomly chosen that. And it's going to give me a bunch of different options for plans. The one that this office has decided this year to work with heavily, based upon my conversations and my relationship with Justin Brock, if you're familiar with him, is Heartland National. I trust they've done the legwork, and the communication is it's the better value for the client. And that's essentially what I look for. What's the best for the client? So we know that the hospital copay lasts for 7 days, so we would want to pick the one that has 7-day benefits. If the copay lasted for 6 days, we would pick the one with 6-day benefits. So we're going to go ahead and click that, and then we're going to click Add to Comparison, and watch what happens. Boom, look at that. It puts it up along the side of the Humana plan. Now, one of the things that this is not taking into account is a household discount. They get a roommate discount if they have a member of their house living with them. I'm not positive on the age. It's either 18 or 60, but I'll get back to you on that one. And it's not taking into account to that. So you know, if you're talking to somebody that has a spouse or they're married or whatnot, spouse, married, same thing, you know in the back of your mind that whatever premium is up here, they're going to get a discount by 7%. So when you scroll down a little bit, what it does is it matches up their benefits to go coincide with the holes in this particular or whatever particular Medicare Advantage plan you've pulled up. So we can add this like a Chipotle burrito, just kind of walking down the line, telling them that I want some pork and I want some salsa and I want some guacamole. So here you talk to your client, ma'am, for $2.40, would you like to take away most of the risk of the ambulance? Client says yes. You go down a little bit, ma'am. As I shared with you, 20% if, God forbid, you're diagnosed with cancer for therapeutic radiology services, and there'll be some co-pays for other stuff. Most of my clients will pick this benefit so that they're not out of pocket. And then also, in the event that you're prescribed trial medications that Medicare doesn't cover, you'll be able to pay for some or all of it. So they say yes. So normally what I'll do is I'll at least match the maximum out of pocket, no less than the maximum out of pocket, especially if they're on a budget. $19.60 is all it costs to close that hole. Nothing for renal dialysis, unfortunately. If they're end-stage renal disease, Medicare will put them into a different plan. It automatically includes emergency room benefit built into the policy. So if they're admitted to the hospital, if they're brought into the emergency room, they'll get $150 to pay the $90 copay. And then the hospitalization, we know it's a $290 per day copay. So I would just bring this up to $300. If you want to try to save the client money, you can come down a little bit, down to $50, and that would just make their exposure $40 a day for 7 days. Okay, again, it's up to you and the client. There's a feature here for lump sum hospital confinement benefits. I think it's a little pricey. $22 a month for $500 per occurrence. That's nearly $300 a year for a $500 benefit. So I typically skip that one over. That's up to you. And then that's it. So look what it does. It closes the hole for the inpatient hospital care. It closes the hole for the ER. It closes it for cancer. And it closes it for ambulance. And it only costs the client $53.80. It's not a whole lot of money, considering that this particular person in this county, in order to get a Medicare supplement policy and a prescription drug plan and some dental and vision, they probably would be paying north of $200, probably closer to $250. And here, for just $53.80 a month, they can close a lot of the holes and a lot of the risks of their hospital indemnity plan. So the next thing you would want to do here, and I'm just going to kind of bring it over, is you want to make sure, because this person is 67 years old, they would have to be underwritten. And forgive my scribble and messiness, but I'm a paper person. But I have the questions here that are asked in the application. If they are between the ages of 64 and a half and 65 and a half, none of these questions have to be answered. It's guaranteed issue. You would only have to answer these two questions if you're doing cancer. And I know you can't see that, but if you were doing cancer, if you were not including cancer and they were 64 and a half to 65 and a half, it would just be a guarantee issue. It's like, here you go. We love you. Take my insurance. But if you're doing cancer, they have to ask these questions. And really, what are the questions? If they've ever been diagnosed with internal cancer, chronic kidney disease, congestive heart failure, all major stuff that would stick somebody in the hospital and then most likely put them in the hospital again. So things to be cognizant about and so forth. So what do we do now? Well, now it's time to do the application. So we would log into our Heartland National. And if you want some help with contracting, we will absolutely help out. It's one of the things we love to do, of course. And you would go to the area over here where it says Secure Flex e-app. Okay. And we're just going to be doing one person. Okay. And they are, what did I say, 67. So that's what, 1951. I could be wrong, but we wanted to do $300 a day. We were going to do it for 7 days. We know that this is in the state of Georgia, and they're married, so we're going to apply the household discount. So let's run the quote, and we get another opportunity to build our burrito with the different benefits. We know the client wanted the $7,000. We know we're going to skip the hospital confinement surgery. They want some coverage for that copay if they need outpatient coverage. Okay, I'm just throwing it in there. Actually, I'm going to redact that. I wouldn't even recommend that. $240 for the year for a $300 benefit. So let's just take that right out. Skilled nursing facility, they're a little worried about that beyond the 21 days. Ambulance, we know that. We want to put that in there. They can choose a wellness benefit. So every time they go and get a physical, they'll get $25. I think it's a waste of money. It's $25 for the year in premium to receive $25. And then look at that. You can always ask them, by the way, would you like to add some dental, vision, and hearing? You can go see any dentist you want, any eye doctor you want. We can do $1,000 in benefits, or we can do $1,500 in benefits. Okay. So what happens here is it's packaged up. Now, it's a little bit more than where we were before because we didn't have the skilled nursing facility pricing built into it. So I'm going to put that back in there real quick. And then you just basically go here, you hit apply now, and voila. Well, voila. Here you go. There's all those questions. You just kind of click your way through. You put in all the information, their banking and whatnot, and you either have them sign it while they're sitting in front of you, or you send it out for an e-signature. And it's literally that simple. So just to recap, CSG, pull up the Humana plan, go to the one that matches their benefits. You cannot give this to them. I mean, you can print it up for your own records, and you can store it in the file, but you are not able to give it to a client. It is not CMS approved. So you can get in some trouble. It's just for illustrative purposes only. It's a pretty form too, but I would definitely print it up and save it in the file. And that's that. And that's how easy it is to sell a hospital indemnity. So what are the next steps? If you are part of our network, reach out to us for any additional questions or training you feel if you want or you need. If you're not in our network, perhaps we should entertain a call to see if we're a good fit for you. We are not a one-size-fits-all. And then finally, if there's any carriers, which today's topic was Heartland National, if there are any carriers that you have seen in this training that you would like to learn more about and see if they could fit into your product portfolio, let us know. And right below is my information. So folks, have a great weekend. And Monday morning is when your season begins. I hope it goes well.